Assalamu alaikum wa rahmatullah. May I have your attention, please?
Yes.
In this lecture, inshallah, we will talk about the future of nursing education. We'll just have a glimpse at the future of nursing education. First of all, let's start with a question. Why do we have the need, the urge to know about the future? Why do we like to know about the future?
The previous practice, because sophistication is our tool coming.
So you want to know what's coming ahead?
Which level we will reach in the future?
Okay,
Our
so you want,
practice.
okay, what else?
Is that human nature to know?
Curiosity.
Future.
So it's a form of curiosity. What else?
I want to know what will happen to me. Lose the flow.
Yeah, you want to feel more secure,
Yes.
right? You have the anxiety related to future. What else?
To put our plan to be
Exactly.
suitable for the future.
To prepare, right? What else? To prepare, to feel more secure, to keep current. What else?
Advance.
To advance, to compete, huh? To be up to date. All of these things interest us to know about the future. So how can we know about the future?
Nobody.
Huh? Can we be certain about the future?
Expected.
Huh?
We can don't know. We can expect, but expectation always make us what?
Only
Yeah.
example, this smartphone before 10 years before it was not there.
Yeah.
Now it's
Yeah.
common.
We can observe future is like happening. Huh? There is advances.
And we
In the-
expect
in the
what
past
we
history.
don't know what would exactly happen.
Exactly. We just have some notions, some predictions. You can take lead from even the best planners. What they will say. We have percentage of the predictions.
The fortune teller.
Huh? The fortune tellers. No, we're not talking about fortune tellers. We're talking about the people who have plans and calculations. Even if they have the evidence, they have the materials, they have expected date to finish the project, expected date to achieve the target, right? So everything is like predicted. We cannot really be certain, but we can make some expectations. So that's why we can just make a glimpse at the future, okay? So our objectives of this lecture, we need to understand the impact of the history of nursing education. Because what makes today is yesterday, right? And we will see what is happening today so we can predict what's happening tomorrow. Also, we will be at the end have some predictors for the future, and we will learn what are the challenges and opportunities. Outline for this lecture: first, we will explore the past, history of nursing, evolution of nursing education. What about the present, current trends in nursing, and the future, possible challenges, and how to deal with these challenges. The past. I would like to start with this quote. To be wise enough to learn from the past, shrewd enough to capitalize on the present, clever enough to prepare for the future. Okay? So this quote is very interesting to start talking about the past. History of nursing.
Previous slide.
Yeah.
أساس في واحد معنا ما اسمه عيد.
This we have to be wise enough to learn from the past, shrewd enough to capitalize on the present, and clever enough to prepare for the future. History of nursing. We will talk about what we know about history. As a nursing, what is when you talk about nursing, what first things come to people's mind? Okay. So, did it come to any point of history, in the history, that people does not need care? So, as old as humanity, nursing is present. So the concept of nursing is as old as humanity. Okay? And the word nursing comes in the English language because there's a cultural background. The word nursing comes from the females doing the lactation. So this comes in the cultural background of the English language. But in Arabic, we have a different word. Doesn't even relate to this function. It's called tamrid, which it doesn't really relate to function of a mother doing the breastfeeding. Does it? So what is the cultural implication that makes the word of nursing in each language? It's different. Let's talk about Islam. What the earliest record of nursing in Islam is the first nurse we know about is Rufaida al-Aslamiyya, which was in the 600s, the first professional nurse in the history of Islam. And she even started the training for nurses by the permission of the Prophet in a tent outside his mosque in Medina. And she has the community rule, which is helping the wound and the sick in Medina. And during war, she trained other female nurses to work to help the wounded and wounded soldiers. Other example of the history, in the 1800s, we have established hospitals. We have actually the modern medicine, the concept of a hospital, a well-equipped place with a proper place for the rest for the sick, for the proper physicians present, for the proper facilities. Started first in the Muslim world, not in the Western world. There also we have a concept of the gender segregation. So male nurses care for male patients, female nurses care for female patients. And also the first officially hired nurse with a salary was hired in the Dimna Hospital in Al-Qayrawan. And also we have some people who are called the Fuqaha al-Badan. They are also helper or assistant for physicians. They are not physicians, they are assistant for physicians. They are working to help the sick beside the physicians. What's the name of this classroom, by the way? Who is Ibn Nafis? He's outside. His description is outside. You can read the description outside. He's a leading. Huh? You know? Yeah, tell us. Please tell us.
No, I don't know.
So he's a leading Muslim physician who has a lot of entrepreneurial rule to discover the. I think he's the one who's responsible for the discovery of the modern cardiovascular system. So he has identified the cardiovascular system because before in the Western world, the physicians were saying the blood comes from the liver and go back to the liver. And he discovered no, the blood goes to the heart pumps the blood and goes back to the body, then back to the heart. He actually defined the proper way how the cardiovascular system works. Let's talk about the West. In the early days, it's very miserable in the West. Medicine was one form of how to make people comply to the church. So the priests only were allowed to practice medicine. And that's why the concept of holy water and the priests only practice the medicine in the church. So the people will always be following the church. After that, also wealthy Christian women learn the self-taught the nursing and they providing nursing services as a form of retribution to forgive their sins. Also, the Crusades caused the initiation of male nurses to join the career. Then the Renaissance happened. The Renaissance happens after the Dark Ages and started all what is the modern West. Medicine started to become in the university. They have official curriculums, and nurses vanished. And because the role needed from nurses is just assistant for a physician, they don't have the dedicated role. Also, the Crusades were finished and no more. So also nursing were happening more in the houses, in the homes of the sick. So the nurse will visit the sick man and do the nursing care in the home. And hospitals were established for poor people by wealthy Christians to also as a form of retribution and salvation. And who done the care? Prostitutes and female criminals. So the history of nursing started very bad by bad people in the West. Fast forward in the last 100 years, we have notable events for nursing education. Florence Nightingale, it's a renowned name, started her nursing school in St. Thomas Hospital. She was a nurse doing care during the time of war. There was a lot of mortality, and when she done the cleaning and the hygiene, she reduced the mortality. I will tell you something. What Florence Nightingale done, she just removed the dirt and the garbage from around the patient. Simple as that. She didn't do like breakthrough. Because the conditions that the people were having in the West and Western countries was very miserable. You can imagine the bathroom, the toilet is in the same place with the patient, and imagine there is no proper drainage system, there is no proper disposal of waste. So infection, rats walking beside the patients, all of this, she just separated the dirty stuff from the patients. So you immediately expect the mortality rate to drop too fast. And she also leaded the hand hygiene practices and how to care for the wounds. And she established a small school in St. Thomas Hospital in London, which is teaching by apprenticeship. So teaching only by apprenticeship. So there is no theoretical curriculum. Also in 1885, there was the first nursing institute, which is started in Japan. Also, Yale University created the first curriculum, which is not hospital-based, because all of the previous one was hospital-based. لا ما أقدر. In 1948, there was a call to separate the theoretical part from the practical part and make the theoretical part more in a university settings. Who called for that is Brown Esther. She is one of the also leaders in nursing at that time. So, we changed from apprentice style teaching to requirement to have a background or ground-based knowledge in liberal arts like sociology, like psychology, and the nurses also required to have more critical thinking. After that, to also more options for to initiate a nurse in nursing career, which is being diploma, bachelor, associate degrees, etc. Fast forward to initiation of master's and doctoral programs, and after that we have nursing scientists who have the doctoral programs. So we have to establish nursing science. Not only nurses study medicine science, they have to have their own science. So we, nursing career, have, as Mr. Faisal said here, we have a lack of literature exclusive to nursing in comparison to medicine. Okay? So nowadays you see the degrees granted to nurses. We have options starting from diploma, associate degree, bachelor of science, master degree, doctor of nursing practice, and doctor of philosophy in nursing, the latest being issued in nursing. So when we have these multiple programs for initiation, what's the challenge? Can this make any challenge for nursing career? Can this make any challenge? We have how many options? 6 options. All of them create a nurse who can practice, right?
Yes, but not all.
Huh?
For example, we have diploma in nursing.
Uh-huh.
It's like aides, nursing aides for us before. Then when we say associate, and it will, you will advance to a more skills or practices.
Exactly. Right. What are the other challenges?
The job security.
The
What
curriculum
about-
is different.
For example, now we can see in our hospital itself, now there is like this many percentage should be only diplomas. Before there was no rule. So now those who are diplomas, they have a challenge now.
They are pushed.
About their
They are pushed to,
Yes.
to advance their degrees. What else?
One more course is there. After the diploma, there is 2 years course will be there. That is equal to the bachelor degree.
To kind to advance to it's accelerated diploma to bachelor degree.
Yeah.
There is also So
Upgradation
Course,
will lead to
upgraded course,
degradation. Upgradation will lead to degradation.
Uh-huh.
Now in India already stopped the diploma.
Yes.
Yeah.
The diploma is stop now.
So now
And
why they stop?
they
Why do you
will
think they
conduct the
stop?
exams. Now the mandatory for the at least bachelor degree.
Uh-huh.
And it's like
And,
a blended.
diploma-
So what will happen to the diploma nurses?
It's a
They have a suggestion for
Limitation.
exam. For pass the exam, that will lead to they can get the bachelor's degree.
They have been given certain time to
3 years.
finish this period of exam.
Okay.
Because
So-
the curriculum
In the
is
diploma,
different.
the
Curriculums are different.
Yes.
So how can this make
We
a
have a
problem?
standard curriculum to read as a bachelor of nursing.
For us, it's like redundancy because for me, we are the last batch in my university to have associate of nursing in our second year, it's like we graduated. And if you will go again to bachelor, the same basic nursing we will study. So it's like you will redo what you have studied from the basic.
So we heard
So the council they started for the diploma.
yeah.
Focus on the Pakistan
Redundancy,
stuff.
Exactly.
competition of what we
Exactly.
have.
So we have job security issues. We have redundancy.
Yes.
We have
Redundancy.
Questionable quality, right?
Mm.
So all of these things can happen because we have a lot of programs and we are pushing people and there is a lot of people who already have diploma, how to transfer to bachelor. So why do you think we have more variety now? Why do you think this variety happens? Why do you think we have a lot of programs?
Advancing skills.
Huh?
Innovation.
improve
Advancing.
and update our
Advanced
degrees.
skills.
Advanced.
Yeah, because the nursing,
To do your own science.
yeah, exactly. We are trying to have our own science. We are raising the bar every year. We are always raising the bar. Job security, even for the highest degrees, are questionable because our nursing is we are in the golden age to renovate nursing, reinventing nursing every now and then. So Why? Because a lot of rules, a lot of requirements, a lot of safety standards, updated quality standards. That's why we have a lot of programs in nursing, which creates a lot of challenge for nursing educators. Also, another challenge, who will teach these programs? Right? Just ask yourself. If you want to give a lot of education, who will give this education? So you need a lot of educators, right? Right? And do we have the sufficient educators? Do you think we have in nursing the sufficient educators to deliver the proper education to how many nurses?
Depends on the country and the authority.
Curriculum will be there.
In comparison to, for example, medicine.
No, we have the curriculum.
Still it's new nursing
Still, how many people in nursing, for example, have the doctoral degree?
Yes.
Very few.
How many have the master degree? We are now fighting to make all have bachelor degree. So you can imagine, we need a lot of education to advance people from here to here, and we need those people to push them. These are the educators in this area, and those people need education. See the ratio from here to here is very less. So this is a big challenge for nursing education.
There is no recognition.
Huh?
There is no recognition. Even you do diploma, graduate, BSc, MSc.
There is no what? Recognition. Why do you think there is no recognition for nursing
The one who is
educational
on the top level
achievements?
for the nurses, they
Huh?
are not.
Why do you think? Huh?
The one who is in the top level for the nursing, they are not preparing this one.
Not preparing what?
The proper recognition.
How? Recognition comes from whom? Now I done something. Who will recognize me? Will I recognize myself?
It should be from the institution, higher up from the institution.
I'm talking about nursing now. Nursing achievements.
We have the separate nursing university.
So I will make it more holistic. I'm not talking about individual achievements. I'm talking about nursing achievement. Why nursing achievement? Within nursing already recognized as achievement, but outside nursing is not recognized. I think this is the problem. Because we can recognize each other as having achievement in education, but we cannot prove it to others, like physicians, hospital administrators, legislators, right? This is not only here, it's everywhere.
Still the cultures still refusing the nursing as a nursing itself, as a nursing as an independent department, not as a doctors. They are always putting us under the umbrella
As
of
always,
doctors, under the
assistant
umbrella
of the
of
physician.
medicine.
Exactly.
Somebody in the
Why? Is it true that actually we are under the umbrella of physicians?
No, we are not, but we need more.
What is the source of your knowledge? Who contributed to the knowledge that you have
We
now?
have independent.
Tell me that 80% of my knowledge are produced by nurses. I will tell you no. You have the right to say, hey, I don't need the physicians. See the dilemma?
Yes.
Who created the knowledge that we are exchanging now?
The nurses now started to have knowledge because of the nursing science, because of the nursing researches. Unlike before, like when we came to be educated before, we have doctors, they are coming from the medicine college to teach us, right? But now it's almost all coming under pure nursing. Almost coming under pure nursing. So we have our own, but it needs to be culture educated, culture familiar. The people of the community itself needs education related to the nursing, that the nursing are coming up here with their own umbrella. So this is actually it's a big challenge.
Exactly. So how can we deal with this challenge? Should we like, hey guys, you are nurses, hey, look at us,
We can make more.
hey, look, I have a master's degree.
No, that
What should I do?
10 or 15 years before, the nurses only for the females, not for the males. Like this.
No,
So is 15 years that much? Do you think 15 years is too long? For the history of a science, let's say medicine is being established hundreds of years. Hundreds of years. I am thinking what we achieved as a nursing profession is a lot faster, a lot more notable than what happened to medicine. Because medicine required hundreds of years to be established and be respected, and instead of just, oh yeah, now before anyone in the village healer who will just give you any herbs, now people starting to think, no, I have to go to the clinic, respect the ones in the clinic, not the one in the village. Do you remember this one?
Yes.
This is even recent history. And this starting now people, there is a lot of people still depends on alternative medicine, which is not research or something like that. So we are progressing. So how to help?
Empowering the nursing.
How to empower the nursing? How to gain your power?
This is the question.
How to gain your power? You should not ask help from others because they don't care what they will benefit from. They will never care. Right? Should they care?
No, Ahmad.
Do we have materialistic benefit from caring about nursing advancement? Do they have it?
Actually, regarding the nursing are under the umbrella, we are not under the umbrella. We are the backbone of the doctor. Okay, we have our own job description, but only the challenge for us is to remove this stigma, from the doctor that we are under by them. We have our own responsibilities and we have our own job description. Listen ba, everybody?
Listening.
I'm explaining because we're not under the umbrella.
Yeah, think of the umbrella.
No, we
Yeah,
have to
think of the umbrella.
I think this discussion create a lot of controversy.
No, because it's sick and tired of this perception from the other healthcare providers. Ustad Hamza, you're sick and tired that only the nurses is under the umbrella of the doctors, right?
No, we are under the umbrella.
Yeah.
But you know what's the problem? The empowering. You know
Yes.
something empowering? That we are as a nurses, I don't mean us as a nurse
Yes.
education, we are as a nursing, we are not respecting ourselves as a nursing.
That's why, because we are not there.
Because of
We're
what?
not stand off.
Because of what?
We are not really
Just listen, please.
because we cannot change.
Why we are not respecting ourselves as a nursing?
That's the question. Why we're not respecting
I will tell you
ourselves.
something. Not so.
I will tell you,
So we'll not get that much.
Yeah.
I respect your point, but I will not.
You know,
Just one thing.
the
Yeah?
present, still the present. You're not the present. There is a future now.
No, guys, this is a food for thought. Guys, this is food for thought. I think we can all agree. Listen,
We will have a debate after that.
I think we can all agree. There is multiple causes. Okay, we came late.
Yeah.
We came late.
You came late.
We came late to the party. Huh?
Guys, we want to
Nursing as came late to the party.
To clarify one thing. Why we are not respecting ourselves? Because if we respect, we are empowering ourselves. The issues that we will not be able to be responsible. You are transferred the responsibility for the physician. Why do that? Because the physician, he asked me to do that.
Yes,
So the
exactly.
physician, he will be responsible. While when I will be responsible, okay, I will empower myself.
Thank you very much. Great answer.
So self-respect.
Okay, so let's talk about the present.
I will put myself.
So, this current trends affects nursing. Increase quality standards. Before, the mortality rate were high because it's expected. Yeah, he has to die. It is a terminal illness. Like a simple flu can be terminal illness, everybody knows. Now terminal flu or just simple flu is not terminal illness anymore. You can just take antibiotics and you will not have any terminal illness. But now we have better treatment. So we have decreased length of stay. So people are not staying to the hospital long time. And they have treatable illnesses. Before it's terminal, now it's treatable. So they can have the treatment, and for many years they have a life. So they have chronic illness increase. And people now not staying in the hospital, but still require nursing care, so they are in the home. So they need community nursing, preventable diseases, increased cost of healthcare due to the quality standards, aging population, people are not dying, so they will age. So you have a new diseases related to aging. We have now more culture sensitivity requirement, right? You hear about political correctness, the black movement in USA started to end racism, speaking about racism, you have to be careful with your language, etc., etc. So need to be culturally competent. The requirement to have evidence-based practice. So everything you are doing to the patient, it's not but someone told me, what is your evidence? So those are things create a lot of challenge for us and nursing education. Other things, the hospital-based schools before, now disappearing. So everything need to be academic and have dedicated staff not working in the hospital. Another thing, the ratio nurses to population is decreasing. So because we have a population explosion, we have nursing shortage. Also, we have limited nursing database, this is what we discuss right now. We need more research, more knowledge database in nursing. So this created a lot of challenge. For example, what challenge does nursing shortage does to nursing education?
Less number of faculty,
Exactly.
less number of people.
And when the nursing either shortage caused by leave or not applying, so you need, for example, you have less faculty, you have less people to teach, and have ratio of less experienced people, right? Less experienced people to teach. Let's talk about the future. These lessons will take to the future.
حرام يا شيخ.
Haram about the future?
I want to know the future.
The future. So what are the challenges for future nursing education? New requirement for nursing. A lot of information need to be learned. A lot of skills need to be taught. We have to identify the learner preference, our clients. We need to deal with a lot of technology. We need to maximize our efficiency and watch our quality. Let's talk about the new requirement for nurses. In comparison to the past, the future nurses are required to have multiple sets of knowledge and skill competencies. Let me ask you a question. What are subjects make the knowledge base for nursing? What subjects you learn in the college, for example? Yeah, give us one.
Medical and surgical.
Huh?
Medical
Medical
and
surgical.
surgical.
Microbiology.
Psychology.
Biochemistry, psychology,
Anatomy,
physiology, biochemistry.
Nursing care management.
Huh?
Community medicine management.
Basic principles and practices of nursing.
Psychiatric
Pharmacology.
Growth and development. Pediatrics. Psychiatry.
Community nursing.
Community nursing.
Nursing. Administration.
Headache.
You have information overload. Physical science, anatomy, physiology, biology, microbiology, chemistry, pathophysiology, food and nutrition, pharmacology. Social science, psychology, sociology, growth and development, abnormal psychology.
This is in past, right?
Huh?
In
This
past.
is this is the challenges.
No, I mean
Already we have.
this subject in social science we learn in past.
Yeah.
But now in future, Facebook, Twitter,
No, but yeah, this is technological literacy. We're not talking about the. This is a requirement also. We'll come to that. So ethics, literature, history, research, mathematics, statistics, how to write, how to compose. This creates information overload. So all nurses will come to our hospital, usually make orientation GNO 5 days, and competency another 5 days, and 3-month probationary period. I have a lot of checklists. You have 33 competencies. You have a lot of courses, mandatory courses, a lot of policies, and you have 2,500 policies on the Dropbox, and you have this and that, and SLS and BLS, all of that to go inside patient room and do some vital signs, medication, etc., 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 right? To be safe nurse, right? Skills and competencies. The nurse need to be competent in patient-centered care, professionalism, leadership, system-based practice, informatics and technology, communication, teamwork and collaboration, patient safety, continuous quality improvement, evidence-based practice. Nurses need to deal with a lot of data. Nursing informatics, dealing with big data. Did you hear about big data before?
Never.
Huh? Did anybody hear about big data? You know what we are dealing? Do you know HIS, Health Information Systems? This dealing with big data. How many pieces of information you collect about your patient? Each patient. How many pieces of information?
More than 5.
More than 5? I can't say more than 10,000 pieces. Each vital sign, each medication giving, each sign and symptom, each episode, each everything. This all information, how to manage this information, how to deal with it, and how to extract lessons, how to deal with this patient in a personalized way. This big data world is like all the aggregate data that's been about you. For example, you know when you log into Facebook, Facebook tracks all your activities and makes a file about you. This is called big data. So when you log in, what's your preferences, what sites you like, everything. So this is dealing with big data. Also dealing with data in key performance indicators. So you need to collect all the indicators data, deal with it, analyze it, publish it. Mathematics is considered the third literacy. What are the other two? Before reading and writing only, right? Then you consider literate. Now reading and writing only, still illiterate. What is the second literacy? Technology. Technology, reading and writing, and mathematics. So this is the 3 literacies. So now we can know why nurses have arms like an octopus. You need to know all of these things to become a nurse nowadays and for the future. So how to deal with this? All of this requirement. Design what?
From the nurse.
Resign. I said it. I thought he said design.
Time management, well planned.
Huh? Time management, planning, excellent choices. What else?
Stress management.
Stress management. Okay.
Stressing us too
Okay.
much.
What else?
Education, courses, continuous education.
Yeah. What else?
We want to be the
Skill enhancement workshops.
Yeah, enhancement workshops. What else?
Reading.
Empowerment.
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 You have to,
The word of the day.
What else?
Empowerment and
you have to
self-respect.
acceptance.
Acceptance.
So, yeah, you have to accept that you are a nurse. You have to
Yes,
possess all the
accept.
Respect,
It's a pleasant
empowerment,
awareness or-
acceptance. Word of the day.
Can you read this? Miserable man.